Hello and welcome to the 2020 Open Enrollment Legislator presentation. My name is Melanie Denning, and we appreciate you taking the time to attend today. A recorded presentation will be available on the HCBD website as an alternative to attending today's webinar. The recorded presentation is available at www.mt.gov/open-enrollment. The Legislator Open Enrollment booklets were mailed the week of October 14th. The booklets are also available on the HCBD website at www.benefits.mt.gov/open-enrollment. Open enrollment will be held this year from October 27th to November 9th. Legislators who wish to make changes to their state plan benefits, including re-enrolling on the Vision hardware plan, must complete their open enrollment elections by November 9th and will do so online again this year. Legislators will have the ability to request a paper enrollment form by contacting Healthcare and Benefits Division. More information will be provided in the next few slides. Before we get into open enrollment details, we wanted to provide some reminders regarding the State of Montana Benefits Plan, or State Plan. The state plan is self-funded and is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are then held by the state plan and used to pay state plan expenses, the vast majority of which are the claims for services incurred by the members for medical, prescription, and dental needs. When you balance our income with our expenses, you get the state plan's reserve. In 2016, transparent pricing, or also known as reference-based pricing, was implemented, and this allowed the state plan to control the cost of health care while maintaining quality, predictability, and fairness. We call this new way of reimbursing providers transparent pricing. This reimbursement model is still in effect today and continues to provide savings that has helped maintain predictability and fairness. In 2017, Navitus became the state plan's pharmacy benefit manager. Navitus allows for a full pass-through of transparent pricing model, which ensures that the state plan receives all rebates and reimburses pharmacies the exact amount paid by the state plan. The state plan continues to see prescription trend, or expense, decrease, and the program is still providing value to the state plan and all of its members. State plan reserves are needed because we cannot control the variables surrounding operating the state plan. We can control many of our plan costs, but there are some things that we do not have direct control over, including our largest income source, which is the employer contribution. The employer contribution is set by the legislature every 2 years, and Healthcare and Benefits provides funding recommendations, but ultimately must comply with the funding set by the legislature. The employer contribution has not changed in 3 years and will not change in 2020. Federal mandates are also directly impacting the state plan expenses. For example, in 2018, the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Care Act, or ACA. In addition, due to recent changes to mental health parity regulations, the state plan has enhanced some of the coverages available for behavioral health and addiction treatment services. HCBD works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims each year, but there can be surprises. Medical trend, which is the increasing cost of medical care, is a huge variable the state plan has little control over, and it can be difficult to predict. The cost of medical procedures and prescription medications continue to rise year after year. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. As noted on the previous slide, HCBD is progressive and is working hard to develop and implement cost-saving strategies to keep employer, employee, legislator, and retiree contributions stable. The combination of all cost-saving actions such as transparent pricing, the Navitus PBM, and the Medication Therapy Management, or MTM program, along with increased efficiencies at the Montana Health Centers, streamlined communications, and reduced HCBD staffing, has allowed HCBD to minimize the financial impacts to all state plan members over the last few years. While progress has been made and money has been saved, now that we are more than 3 years into the transparent pricing agreements with hospitals, HCBD now believes there is an opportunity to do even more to control costs. We will be asking our hospital partners to look even more closely at pricing, and we ask that state plan members look at any care you might have outside the state and, if appropriate, consider keeping it with our in-state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising costs of healthcare on behalf of all state plan members and taxpayers of the state. Employee, legislator, and employer contributions will remain the same for 2020. HCBD is pleased to make that announcement and would like to highlight that this is the 4th year that the state plan has been able to pass on a $0 increase to the state of Montana and its employees and legislators. This is unheard of in the health insurance market and is a testament to the work that the HCBD team does to control costs and find savings. This slide reflects the medical, dental, and vision hardware rates for 2020. Again, there is no change to the rates for 2020. This slide reflects legislator life insurance rates. Again, no change. If a legislator opts out or waives state plan coverage, the legislator is able to receive a reimbursement up to $1,054 per month for premiums paid by the legislator in conjunction with an employer group health plan or premiums paid for certain types of disability and life insurance. The state plan is restricted by federal regulation from providing reimbursement for Medicare, Medicare Supplement, Medicare Advantage, including coverage through an insurance carrier, or health insurance marketplace premiums. To opt out or waive state plan coverage and receive the Option 2 reimbursement, please complete the legislator opt-out or waiver form found at www.benefits.mt.gov/forms. Reimbursement of any kind is not available if the legislator has enrolled on the state plan. The legislator rates are outlined in the Legislator Open Enrollment booklet on page 4. Again, these were mailed to all legislators the week of October 14th and have been posted on the HCBD website at www.benefits.mt.gov/open enrollment. We are pleased to announce that there will be no changes to the medical plan out-of-pocket costs, which means the medical plan copays, the deductibles, and the maximum out-of-pocket costs. They will stay the same for 2020. You can refer to the Open Enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. And please remember, state plan members cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered by the state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage, even if you have a work comp waiver. Please make sure you and your covered dependents have proper insurance in place to cover work-related injuries. This year's Live Life Well incentive deadline is October 31st, 2019. Don't miss out. Hopefully, you've already had a state-sponsored health screening. We have sent many reminders. Legislators must complete all 3 requirements to earn any incentive. we have added extra screening opportunities at the Montana Health Center locations for October, but we cannot guarantee members can get in if they have waited. Incentives earned in 2019 will be applied towards your 2020 state plan year contributions. Visit the website at www.benefits.mt.gov/incentive for complete instructions and more detail regarding the incentive. Remember, participation in a state-sponsored health screening will automatically be reported to the MyActiveHealth website. However, it does take about 1 month from the date of your screening to show up on the website. To earn your full incentive, you must self-report your nicotine status or alternate activity and the next step activity on the MyActiveHealth website. Even if you participated in a wellness challenge such as the Governor's Stay Active Challenge, you still need to report that you completed the activity in the MyActiveHealth website to earn the full incentive. If you are not nicotine-free, but you completed an alternative like a nicotine cessation program, you have to self-report that as well. You should self-report your nicotine status and the next step activity as soon as they're completed. You do not need to wait for your health screening activity to show up on the MyActiveHealth website. Remember, additional instructions are available on our website at www.benefits.mt.gov/incentive. If, when you are ready to self-report your activities, you will visit the www.myactivehealth.com/SOM. We do recommend that you first review the information on the benefits.gov incentive website prior to reporting nicotine and next step activities. If there is a medical reason that you cannot do any of the parts of the Live Life Well incentive, there are exceptions and alternatives available. Call the Healthcare and Benefits Division to learn more, or email us at benefitsquestions@mt.gov. The 2020 Live Life Well incentive program will be the same. However, HCBD will be asking participants to participate in a next step activity that is focused on their specific risks. The 2020 Live Life Well program restarts November 1st, 2019, and all 3 incentive activities must be completed by October 31st of 2020. That includes the state-sponsored health screening, self-reporting that you're nicotine-free or have completed an alternative, and that you've completed and self-reported a qualified next step activity. This year's open enrollment period runs from October 27th to November 9th. Legislators should complete open enrollment elections online or via a mobile device. The open enrollment booklet contains all the information that you need to know about completing your benefit elections. The booklet was mailed the week of October 14th, and the open enrollment system will be open for enrollment starting October 27th. If you do not have internet access, or you would like to manually complete your open enrollment elections, please contact the Healthcare and Benefits Division at 800-287-8266 or via email at benefitsquestions@mt.gov. If you requested a paper enrollment form last year, you will automatically receive a paper enrollment form this year. These forms will be mailed out the week of October 21st. Again, all open enrollment elections must be completed by November 9th, even if you complete your elections manually. During open enrollment, you can make changes to the state plan coverage. You can also add or delete dependents from the plan. This is also the time to elect or re-elect the Vision hardware plan. Remember, it will be terminated effective January 1st, 2020 if you do not complete an open enrollment election, even if you had Vision hardware coverage in 2019. Again, if you do not complete an open enrollment election, you will have the same medical, dental, and life insurance coverage that you currently have. If you do not complete open enrollment election, your vision hardware plan will end on January 1st, 2020, even if you elected coverage in 2019. The open enrollment period is also a time that legislators and employees can elect to be joint core. If you and your spouse or domestic partner both work for the state and are eligible for benefits and have dependent child or children covered on the state plan, then you should be joint core. Being joint core means you have one shared family max out of pocket, and the rate is better than being employee only and employee children. For more information, contact HCBD. If you do not wish to make any changes to your current coverage, or elect or re-elect the vision hardware plan, you do not need to do anything during open enrollment, and you do not need to complete anything online. Remember, if you do not complete the 2020 open enrollment election process, you'll have the same medical, dental, and life insurance coverage for yourself, your spouse or domestic partner, and or your dependents in 2020 as you have elected in 2019. You will not be enrolled on the Vision Hardware Plan unless you complete an open enrollment election. Please contact the Healthcare and Benefits Division at 800-287-8266 or via email at benefitsquestions@mt.gov if you have any questions. And remember, all open enrollment elections are due November 9th. To begin open enrollment, you will need to access our website at www.benefits.mt.gov. You will then select the red button entitled Click Here to start open enrollment. This red button will only be visible during open enrollment, which does not begin until October 27th, 2019. If you're a first-time user, you will click on Register, and you will set up a username and password and answer security questions. Our company key is State of Montana, all lowercase, no spaces, and will be pre-filled in for you. If you have already registered but have forgotten your username or password, you will then click on Forgot Username and Password and follow the instructions. Once you're logged into open enrollment, then you will select Start Here, and you will follow the instructions to complete your open enrollment elections. You have to complete open enrollment by November 9th, and the system will show you the number of days remaining to complete your open enrollment. Like last year, you'll be taken to a page to verify your information, a dependent page where even if life insurance designees must be listed, and then through each benefit offered. At the top of each page is a blue box that contains important information for that page and benefit. Please read this information because much time has been spent to assure that the instructions are helpful and understandable. As you navigate each benefit, there will be a box to the left of the screen that will track each benefit and any required monthly contribution associated with that election. This is a great way to assure that every benefit page has been reviewed and nothing has been missed. Please note that the contribution costs displayed are monthly costs. Important. The vision election. There will be no appeals approved this year if you fail to enroll or re-enroll in the vision hardware benefit. On the vision page, there are two vision plan options available: basic vision exam only or the vision hardware plan. You must either select the basic vision only or the vision hardware plan by pressing the select button next to the election you want. If you want vision hardware, you will scroll down and select the vision hardware plan. By selecting the Vision hardware plan, you will get both Basic Vision and the Vision hardware plan for you and any covered dependents that you have enrolled on the medical plan. Remember, the box on the left side of the screen will track your benefit elections. If you intended to enroll in the Vision hardware coverage, there will be a cost associated with that coverage. If no cost is listed, you will only have elected Basic Vision and will not be enrolled in Vision hardware coverage for 2020. Once all of your elections have been made, you will be prompted to confirm your elections and agree to the amount billed. The amount shown will be a monthly amount for Legislator coverage. Once you are complete, you will be taken to a confirmation page and can print a copy of your elections by clicking on the Print Benefit Summary button in the top right corner of the screen. We highly encourage you to print a copy because remember, there will be no appeals on the Vision hardware benefit this year. You also have the option to download the My Choice mobile app on your mobile device or tablet to complete your open enrollment elections. This app is easy to download, install, and is available for use all year long for any updates and changes that you may have. This is a great way to keep your address up to date so that you don't miss out on any of our mailings. To access the app, first you must use your computer and go to the HCBD website and click on the red bar to start open enrollment. If you have not already established a sign-on, you must first do that to get logged into the system. Once you are in the system on your computer, you will click Get Access Code, which will be in the upper right-hand corner side of the screen. You will choose the phone operating system and you will enter your mobile number. You will then receive a text on your mobile device or tablet with a link to download the app on the device. Once the app is downloaded on the device, then it will require an access code which you will need to enter, and that is listed in step 2 from your website or computer to sync up the information and complete your enrollment using the mobile application. You will receive notification when your 2020 benefit summary has been finalized. After you have made your 2020 election, you can always access this summary at any time by logging into the enrollment system and clicking on Benefit Summary. But watch for the notification and then go online to verify that we have you enrolled correctly for 2020. During and after open enrollment, other important documents will be coming from HCBD, including the 2019-2020 WRAP Plan Document, or WPD, which outlines everything that's covered and all plan details. You will also receive a summary of benefits coverage that is a legal document required by the Affordable Care Act and is a short summary of our plan. Medicare Part D creditable coverage letters have already been mailed out and received, and there are a few other legal notices still to come. The Department of Justice has asked us to include this slide as a reminder to you that Real ID is due to be completed by October 1st of 2020. Any questions you may have on Real ID can be found at their website, www.mtrealid.gov. Looking for more information on your benefits? Please feel free to contact the Healthcare and Benefits Division staff with any questions or concerns at 800-287-8266 or email us at benefitsquestions@mt.gov. Thank you for your attendance.